Text. Men in Focus. Chapter 6. The Impacts of Masculinity, Men's Health and Wellbeing. Our watch acknowledges the Wurundjeri Woi-wurrung people of the Kulin Nation as the traditional owners of the land on which this video was produced. We pay our respects to all traditional owners past and present, and recognize the continuing connection Aboriginal and Torres Strait Islander people have to land, culture, knowledge and language for over 65,000 years, and their leadership in preventing violence against women. The presenter of this video, Shane Tass, stands in the studio and speaks to the camera.
We must also acknowledge that men themselves can experience violence and other negative impacts due to rigid ideas of gender and other social forms of discrimination and inequality.
An M character appears on screen, symbolizing a man. A black violence scribble appears, along with 3 colored icons representing different forms of discrimination.
For instance, men who try to live up to rigid ideas of how to be a man experience greater health risks for themselves, including higher rates of depression and suicide.
2 pie charts appear. The first pie chart has the text, "Regular thoughts of suicide are reported by 22% of men aged 18 to 30 who conform to rigid ideas about how to be a man." The second pie chart has text, "Regular thoughts of suicide are reported by 3% of men aged 18 to 30 who do not conform to rigid ideas about how to be a man." Source: The Men's Project and Flood, M. 2024. The Man Box 2024, Re-examining what it means to be a man in Australia, Melbourne. Jesuit Social Services, page 91.
These men are more likely to engage in risk-taking behaviours, such as dangerous driving and substance abuse, and they are less likely to seek help and support.
2 more pie charts appear. The first pie chart has the text, "Report behaving dangerously while intoxicated 49% of men aged between 18 to 30 who conform to rigid ideas about how to be a man." The second pie chart has text, "Report behaving dangerously while intoxicated 21% of men aged between 18 to 30 who do not conform to rigid ideas about how to be a man." Source: The Men's Project and Flood, M. 2024. The Man Box 2024, Re-examining what it means to be a man in Australia, Melbourne. Jesuit Social Services, page 101.
Men and boys who experience discrimination and disadvantage due to racism, homophobia, ableism for example, experience disproportionate negative impacts to their health and well-being, including experiencing higher rates of violence from other men.
2 bar charts appear. The first bar chart has text, "People who are gay and bisexual experience depression at 4 times the rate of heterosexual people in Australia." Source: Beyond Blue, 2023, Mental Health Statistics. Australian Bureau of Statistics ABS 2023. National Study of Mental Health and Wellbeing, 2020 to 2022. The second bar chart has text, "The rate of death by suicide for Aboriginal and Torres Strait Islander men is 2.6 times that of non-Indigenous men." Source: Australian Institute of Health and Welfare, 2023. National Mortality Database. Deaths by suicide among First Nations people. Canberra, Australian Government. Sarah Hewitt speaks to the camera.
So we know that rigid ideas of masculinity can be a problem for everyone.
An illustration of a man symbol inside a box appears beside her.
It can shape the sexist and disrespectful attitudes and behaviours that we see everywhere and help drive men's use of violence against women and people of all genders.
The black violence scribble animates into frame behind the man box illustration.
But it also leads to poor health outcomes for men themselves. This means that working with men and boys to promote healthier, more positive forms of masculinity can benefit everyone, but this work needs to be done carefully.
Text: Promote positive forms of masculinity. 2 illustrated people icons animate into frame. They high-five each other.
Efforts must consider how to address and frame the impacts on men, while also making sure we maintain a focus on gender equality and preventing violence against women, where extensive work is still required.
Text: Supports available. 1-800-RESPECT. National Sexual Assault, Domestic Family Violence Counselling Service. 1-800-737-732. Men's Referral Service. Operated by No to Violence. 1-300-766-491. Australian Human Rights Commission. 1-300-656-419. 13 1392-76. Sane. We're people like you. 1-800-187-263. Q Life. 1-800-184-527. This video is a part of a suite of Men in Focus practice resources produced by Our Watch and supported by the Australian Government Department of Social Services. Visit ourwatch.org.au. Our Watch, preventing violence against women.